Millions of Tanzanians rely on the Health Basket Fund without ever realizing it. It is one of the most dependable sources of health care funding in the country. While the hospitals are confident they will receive the amount expected, they are uncertain about when those funds will arrive, often waiting up to 6 months. These delays cost a host of problems, particularly when the funds are used to deal with stockouts of medicines and supplies at the MSD. No one sees this more than the people on the front lines. The individuals who must tell the patients on a regular basis that services are not available to them.
You lose the credibility because these people, you are working together, you are living together, you are living in the same family. They don't understand you if you are the one who is encouraging them to come. And when they come, they don't get the service that they are supposed to get.
This trust between staff and patients is jeopardized, particularly in the mother and child clinics. Patients are told it is imperative to be tested, and then when they show up for appointments, they often find out that the necessary tests, medications, or vaccinations are not available.
These mothers got an appointment of today. They come today for checking the blood for their kids. And today when they came, there was no test kit. So it was a big problem because they were distressed. Maybe they will think that I'm not concerned with them.
Imagine, as a parent, being told that you have to choose between your children.
The one mother had twins, so I have just took for one twin. Only one twin was taken the test, the other one, only those two more were not tested.
Life-saving blood donations to infants with malarial anemia can also be seriously impacted by the delay of funds.
If they find that you are not doing any blood donation because you have no facilities to do donation, okay? Because you have no money coming to buy equipment for blood donation, of course that people will run away and go back and say there are no services there. The repercussion to them will be there are no services there, and most of the children will be dying in their home states.
The hospital staff experiences this reality on several levels.
The motivation of the staff will come in the sense that you need to procure essential equipments that are assisted, that are used in service delivery. Normally, any health professional would like when he's working, he must have the working tools. If he doesn't have the working tools, straight away he will be demotivated.
Staff training is an essential basket fund activity. The delay in specialized training can mean the difference between life and death.
If you are to train people, for example, people who are to do neonatal resuscitation, if you don't do the training in time, that means you are going to have a lot of children who will die.
For example, if a hospital is losing one child per month because nurses are not trained properly in neonatal resuscitation, a 6-month delay in funding is 6 lives lost. HIV remains one of the most complex challenges to the healthcare in Tanzania. While basket funds have been beneficial to projects such as community outreach, counseling, testing and treatment, as well as advancing the awareness of all disease progression, healthcare professionals fear that the delays in funding will make it difficult to sustain the progress already made.
I am working here at CTC. Now we have almost more than 2,000 clients.
People come to the clinic for a variety of reasons. This young woman and her fiancé were tested together before their wedding day. We had the privilege of being present when she found out her results. While her news was an enormous relief, others are not as fortunate and must learn to live with HIV.
We are doing our best to educate, to discuss with the patient, to tell them about the importance of medication, not missing their medication.
Sometimes